I am Dr. Kapil Kochhar, Head Department of General Bariatric and Minimally Invasive Surgery, Artemis Hospitals, Gurugram and Delhi. I have an experience of nearly 30 years after my post-graduation, although I perform all general surgical procedures, but my forte of interest is minimally invasive oblique laparoscopic procedures. That includes all types of laparoscopic advanced general surgery procedures. That includes all types of advanced laparoscopic gynae procedures, and it also includes all sorts of advanced hysteroscopic gynae procedures. Needless to say that we are also doing laser and robotic.
So the first question that we get, and it is the most basic question that we get, is what is minimally invasive surgery and what makes it different from traditional surgery?
As the name suggests, minimally invasive. Minimum means less, and invasion means attack on the body. Because any surgery is like an attack, like an invasion on your body. So if we cut open to treat a patient this much, the attack is this big. But in case we are using laparoscope or say robotic, then we are making tiny holes. The maximum size is say tip of my finger. Even if we make 3 or 4 such holes, you can imagine that it will be much less as compared to completely cutting open the patient. And after healing, in case there is an open surgery, which is like done in most parts of the world, we get a long, ugly scar. And that part of the wall, abdominal wall, becomes weak and prone to complications later on. And therefore, because the cut is big, therefore healing time is also big.
So, how does minimally invasive surgery improve recovery time span and reduce scarring for patients?
As I already mentioned, because the incision is small, therefore scars are small. And to be honest, in certain people who have fair skins, after 6 months, even they cannot recognize where were the scars. Forget about the rest of the people. So if the incision is small, so healing time is quicker. So that is why the recovery is faster, because the post-operative restrictions like bed rest, bending down, doing exercise, going back to work, all these things are not there. Patient is up and about. In fact, in my patients, for example, gallbladder surgery, I have seen them working from the hospital bed on their laptops, and most of them are joining back on fifth day. And most of our laparoscopic procedures that we do on our international patients, we find that after 3 to 4 days of discharge from the hospital, they are flying back to their countries.
So, can you please walk us through a typical laparoscopic surgery and tell us how you perform it and what the patients can expect from that?
See, laparoscopic surgeries, a walkthrough can be done only when you tell me that a particular procedure. But yes, in a generalized fashion, what I can tell you is that first of all, we diagnose the patient, we select the patients for laparoscopic surgeries because the best results are obtained only after we find that the patient is suitable for laparoscopic surgeries. If you try to do laparoscopic surgeries on patients who are not suitable or where the disease is extremely advanced, then the results are poorer as compared to open surgery, and that brings a bad name to laparoscopic surgery. So, just for the sake of doing laparoscopic surgeries, we don't do it. So, the first part is analysis of the patient. Second thing is a clear diagnosis, the extent of the disease, and third thing is that how far the patient is going to benefit from that. So after all these things have been done, the patient is considered fit for anesthesia, then we take him or her for laparoscopic surgery. And the first thing that we do is in this is the basic thing is to create a pneumoperitoneum, meaning we inflate the abdomen. You understand that in case we are cutting open, we can pull both the sides together, there is space. But when we are not cutting open, there is no space. So first we inflate the abdomen like a balloon and we get space. And then under vision of say 3D vision or high definition camera systems, we introduce camera from one port and then we have multiple instruments. And under a direct vision, we keep on operating. So the thing is the advantage being minimum holes, we are not touching the body directly, and unlike the open surgery where only the surgeon and the assistant can see something, here everybody can have a same view. In fact, even the same view can be transferred all over the world. So even surgeons from other parts of the world can benefit from that because everybody is having a look over there, and so everybody can actually contribute in making surgery a bigger success. So once the surgery is done, if a particular organ has been taken out, we take it out through one port, one of the holes, even if it means that we have to increase the port by say a centimeter or so, and we safely take it out and all the ports are closed. In case the surgery involves some sort of a repair work, we do it inside only. There is no need to increase the size of the port. The dressings are small, the stitches are absorbable, and patient is up and about the next day.
Thank you so much for answering all our questions, sir. It has been a very enlightening session. Thank you, sir.
Thank you.